just while Will does that, do have a look. As I say, if you've not had the chance to say hello in the chat, it's really lovely to hear from everybody, and a special warm welcome to, I know there are some people here for the very first time. And here we go. Fantastic, Will. Great work.
Okay, I'm back.
You've got a beautiful slide. It's on, it's this big here. So back over to you.
Okay, so yeah, this next few minutes, I'm just going to frame some of what I hope will be a meaningful discussion among all of us as a group, and get you to start thinking reflectively about this experience of shame and its potential relationships with kindness. So I want to just first acknowledge Luna. Luna Dolezal. Luna's on the call. Luna, you were like 3 or 4 screens deep for me, so if you can wave your hands so people can see who you are. Luna is a fantastic colleague, friend, and she co-directs the Shame Lab with me. I just want to provide an upfront acknowledgement. Everything I'm going to talk about is work that I've done and doing with Luna. So I got the chance to talk, but Luna is very much a really important part of this presentation. So thanks, Luna. When Bob told me we can present on shame and kindness and you have 10 minutes, I thought, well, I'm too wordy and shame is too big to try and cram it all into 10 minutes, what I want to tell you. So rather than trying to tell you and use just words to provocate here, I'm going to use some art. And the art that I'm going to feature today is produced by a just brilliant, amazing soul named Hannah Mumby. She's just such a lovely person and one of the most talented artists with whom I've ever worked or encountered. And Hannah did all the illustrations that we're going to feature today. And I can't recommend her highly enough checking out her some of the work she's done for. So before we dive into a set of illustrations that are meant to get you thinking, I want to just define shame at the outset, not necessarily to convey this as the definition of shame, but to give a definition that at least gets us all on the same page as we think about and reflect on our experiences. So this is a kind of an amalgamated definition from various sort of dimensions of psychology. But I want you to think about shame for now as an emotion that occurs when we typically self-evaluate, we may transgress a standard or a norm, and as a result, we feel like we're being negatively judged by others or we feel globally deficient or flawed or unworthy in some way. So it's a globally negative assessment of the self that often brings with it very potent and powerful feelings of negative judgment. And that negative judgment might be from someone who is actually in the room, in our sort of real existence. It could also be an imagined other through whose eyes we look back at ourselves and really engage in self-judgment. So when we feel shame, the predominating sort of emotion and self-evaluation is I am bad, I am wrong, I'm not good enough, unworthy, I don't belong. Whereas if you can contrast that to guilt, which we could do on another day, guilt is more attributed to actions, circumstances, things we've done or specific behaviors, while shame is a global negative assessment of the self. Now, shame is really important emotion. It's critical, actually, and it's an emotion that we've all evolved with and that we're stuck with. And it does important things for us as a group of cooperating social humans whose existence demanded that cooperation over our evolution. So one of the really powerful things about working with shame, and it's a hopeful thing, is that this is an emotion that when we feel it, it might feel wrong and it might not be terribly productive and could be very distressing, but it's not abnormal to feel shame. In fact, it's highly normal to feel it. It's just that in certain circumstances, it may not be appropriate to feel it, or we're being made to feel shame when we shouldn't. So this is where we get into sort of the wide-ranging contours of shame, and I'm not going to go there. What I'm going to do instead is bring us into a reflective stance about why we don't talk much about shame and how we might begin doing it. To do this, people make fun of me that know me, but I live in metaphors. I sleep, dream in metaphors. I talk in them. I write in them, and thank God I study shame, because metaphors are so helpful in elucidating this complex phenomenon. And the one metaphor we've used a lot is that of an iceberg, which is a bit overused, but it really applies here. And I use this a lot to frame the notion of shame in healthcare. We spend so much time talking about sharing, even going out on a limb and vulnerably expressing our experiences. Some of those experiences are hard to talk about. most of the experiences that are hard to talk about or that are distressing are ones that we have entered into our lexicon and that we can easily measure and that have become appropriate and okay to talk about. Burnout, depression, stress, etc. But there are these huge fundamental swaths of our experiences, particularly those at the self-conscious level or how we feel about ourselves, that we don't talk about. We don't talk about them. We don't measure them. We can't measure them. And it's often because we don't measure them that we don't talk about them. And there's taboo and stigmatized nature, especially within the context of emotional stoicism in healthcare, where emotion can be seen as weakness. When those sort of mix, the shame experiences we have, the way we feel about ourselves, are often pushed to the side, repressed, or entirely disengaged with at all. And this has all sorts of negative outcomes, and we could talk all about those. But in essence, that repressing of these fundamentally human experiences dehumanizes us. It makes us less human, because shame is a human emotion that we can and should be able to express, talk about, and engage with. So to do that, I'm going to take you through a 4-series illustration that Hannah did for us. And Hannah took a body of our qualitative data from a study on shame in medical students, crafting a visual depiction of what a shame experience can feel like. This is certainly not the only. This is going to depict a more acute-based shame experience, recognizing that there are many other ways that shame can be experienced. But it does bring to light some very salient points about this emotion. And what I really want you to reflect on as you see these images is the role or the absence of kindness. Okay, the role or the absence of kindness in the shame depiction. I'm also going to give you a QR code so that when we break up in our small groups, you can go back as a group and look at these and talk about them if you would like. So I'm not going to give you all interpretations of this. In fact, I'm just going to give you one very quick one, recognizing that there are many ways that you can interpret and see these images. So in this image, there's something happening. Most people kind of follow it from top left over to the right. There's an encounter and a teaching exchange in a hospital. And there are some dynamics at play here, okay? And there's an emotional reaction that begins building. And there's a lot to talk about in terms of what this part of the panel here depicts, in terms of the relationships, the communication, the interactions, the perceptions that may be happening. This emotional reaction begins to build and brings with it some intensity, some, bright color, some heat, distress, anxiety, fear, fight or flight. I can tell you as someone who's made some pretty significant medical errors in my career, this is very much how I felt in the moment of the error. And then there's something going on with the people around them. And there are different ways of interpreting this part of the image. I'll just leave it to you all maybe to think about, as well as, again, where is kindness in this? And then the trailing sort of emotion is the person in many ways picks themselves up and drags himself almost like a wounded animal bleeding out of the limelight and into a safe, hidden space where they can express emotion more authentically. Okay, and we saw this interaction, we saw this affective upswell in numerous of our participants' experiences of shame. Again, this is not the only way it can be experienced. What we often found is that when people after navigating some of the immediacy of the emotional reaction of whatever prompted that affective upswell, that then the cognitive resources became more available to consider, well, what does this mean for me as a person? And that's where self-evaluation really begins to take root. Okay, and this would often happen in a place of relative or actual isolation, detachment. Luna uses this great term called the theater of our minds, and often the theater of our minds is audienceless. It's just us on a stage looking back at ourselves, thinking about ourselves, analyzing, wondering. And that can be, even in the midst of a lot of people around us, a very isolated place to be in our own minds. I think of it as a headworm. That's how it manifested for me before I understood shame. It was my headworms. There's a lot to talk about with this image and what the colors mean, what the swirling patterns mean. One thing that is obvious here is that the thoughts here are posed more as questions. And while this came in maybe succession to the first panel, I've had experiences, and we've certainly encountered others who've had experiences where this panel could have been the first, panel 0, and then the experience with the attending in the hospital running away could have been panel 1. So I exist and have existed at times in my career, and especially during transitions, in a place of just general insecurity about myself. And this is what it sounded like and looked like. There's also this presence of the white coat and some physical, if not metaphorical, distance there that's worth considering. What we found in a lot of our participants, and we've heard from a lot of folks when they tell us about their shame, is that if left unabated, if left unchecked, or if the trigger is potent enough, that this thought process can gain steam and catalyze. It can exacerbate and feed upon itself. And this third panel helps to depict that. Right? The energy is different here. The questions have transitioned to statements, and they're maybe not being quietly asked anymore. They're being screamed and yelled at me by the voice in my head, the voice of shame, which is now dominant voice, if not completely drowning out any voice of validation of belonging and worthiness. And that in the midst of what we've called a shame spiral, which again doesn't happen with every shame experience by any means, but when it does, it tends to sort of characterize itself by runaway thinking. So shame in one area of my life, shame related to an error that I made as a resident, is now beginning to seep into other areas of myself. Partner or a loved one, me as someone who's just worthy to be here at all, right? When shame is at its most profound, those really deeper questions of fundamental belonging and worthiness can become implicated and at play. And critically, there's something happening here with the environment, with the physical space around the person. There's a skewing and a contorting of maybe what's real, what seems real. And shame is often kind of marked by this set of cognitive distortions whereby we have a hard time evaluating ourselves in accordance with what some other realities might dictate. That the predominant reality through which we see ourselves is one rooted in negative self-judgment or perceived negative judgment from others. And so there's this, what we call the skewed frame of reference, where it can be hard to analyze and understand ourselves through alternate realities than the one that we are predominantly situated within. Okay, so there's something to talk about here. And I think there's also, even though we're in an isolated place and there's not another person in the room, that there is a lack of or a role for kindness. And I think that's worth exploring. And then the fourth panel, actually, no, this is, I just inserted this one because I came across it as I was preparing for this, and I thought, gosh, this is such a perfect illustration of what it feels like to feel acute or chronic shame in a healthcare environment. And it also is what it feels like to be in a healthcare environment sometimes, where you're insecure, you don't know where to go, you don't know who to turn to, and no one's very kind. No one's very friendly or open or welcoming. They don't use your name. They don't know who you are. And that in moments of really profound distress, it can feel exactly like this image sort of depicts. And again, where is kindness in this? And where is the function of kindness when we feel this way in our environments? How can we leverage it? So bringing us to the final panel, this shows what we used to call a resolution. And now we understand this is not resolution at all. This is a processing. It's an engagement of and with shame. And maybe there is some tempering of it. There's a degree of control that's being taken here and internalization in some more constructive way, but it doesn't ever resolve. I mean, I would argue our shame never leaves us. We just learn how to live with it and process it and then move on from it or through it. So there are elements here. This is maybe the one most worth talking about if you're going to talk about this illustration, is what's happening here and what is the role of kindness, and how does this expand what kindness can be and what it means to us, right? When we think about the depths of the levels at which shame occurs and through which connection can occur when we bring ourselves with others to those levels simultaneously. How does that expand what kindness can be and what it is? And then talking some about what some of the artistic elements mean. Okay, so that brings us to discussion. And the discussion can go in whatever direction you want. I mean, I would encourage you first to just take a moment and just sit and think and reflect. I would say if you're having any sort of emotional reaction, recollecting any of your own experiences, or if this is triggering some of those feelings, just practice acceptance You do not have to share them at all. And if you feel comfortable sharing them, I would imagine, Bob, this is a confidential place, and a place where if you're going to share anything, I would think that the Kindness Network is a place that would be ready to hear it. But as you reflect on your own experiences, a few questions that I've posed just to think about, in addition to thinking about the image itself or the images, what is the role of kindness in healthy shame engagement? It's funny when I talk about how to become more shame confident or more shame sensitive, so often I just end up talking about being kind and being respectful and being empathic. The same thing as I try to teach my kids. What does it mean to use kindness in providing that empathic support, and then to avoid inducing shame? And that's not something we talked about, but all of us have the capacity to make another person feel shame. And sometimes we do it in misguided ways. Where does kindness factor into helping us avoid shaming others or them perceiving or feeling shame from our interactions? And then maybe even more significantly, what is the role of self-kindness? I don't know in your network how much you talk about self-kindness, but there's a profound role for this, and it's often one of the hardest things to cultivate when we feel shame. So being able to do it or having others orient us to self-kindness can be a really powerful way to process our shame in healthy ways. Here's a QR code. You can just scan this real quick. It'll take you to the comic on our the Shame Space website, which I'll tell you a bit more about at the end. You have to scroll down to see the 4 images. And so, Bob, I'm going to turn it back over to you, and maybe if I could have just tell folks a little bit about our network, that would be awesome.
Fantastic. Wonderful. Will, thanks. Oh, hang on, we are echoing a bit. How's that? That's better, I think. Listen, absolutely fantastic. So much in there, and the illustrations, wow, they're really absolutely amazing. Yeah, so much to think about. I hope everyone's got that QR code, or certainly anyone. A lot of you who are driving, you can avoid getting the QR code, but everyone else, grab that. Will, do you want to? Why don't you tell us a little bit about the network now?
Yeah.
Then we've got it there, and we haven't forgotten about it. And I know you've got some codes and things you can put in the chat. And then while you do that, I'm just going to tee up the rooms, which are almost there. And then let's go for it. We'll go and get in the rooms. But back over to you just to talk a little bit about the network.
I'll be very brief with this. The Shame Space is an initiative that Luna and myself and some colleagues at Exeter and Duke NUS in Singapore and at Duke developed a couple years ago. And we've been reflecting on ways we might leverage this network in this space to drive more sort of dynamic interaction around this topic of shame. In many ways, taking inspiration from what you all are doing. So one of the initiatives we're going to launch next is just something not dissimilar to what we're doing now, but with a square focus on shame. And there's so many topics and subtopics to explore within this broader construct that we're going to do that over a series of quarterly symposia and discussion sessions. If you like what you're doing with the Kindness Network and you want to explore this topic more, I think you would find a very similar, I hope, group of folks and openness and willingness to talk about something that we experience but don't talk about much. So we would love to invite you. If you would like to come, or even if you just think you might want to come, it's fine to sign up and then no show. Don't worry. We would ask you to just jump to this link down here or use this other QR code and just fill out a quick Google form, and then you'll get email invites from us to join the webinars sometime in the days thereafter. So big thanks to Suzie and Sandy Miles, who are going to be kind of co-leading this with Penelope Lusk, and then Luna and I participating as well. All right, Bob, over to you.
Fantastic. Will, just amazing. And actually, maybe what I'll get you to do as well, if you unshare from here, and then if you just paste that into the chat, it'll stay there, and then people can get to it as well. Listen, that was absolutely wonderful. Without further ado, let's dive on into some breakouts. As ever, the technology, you disappear into the ether for about 15 seconds, and then hopefully magically appear with 5 or 6 other wonderful friends and colleagues. Let's go to 1/4 to the hour, wherever you are. So that's nearly 20 minutes or so. And for those of you who have tech problems, or you might be dialing in as a guest, not on the app, you may not get into a room, in which case I'm going to be there to look after you in this main room as well. If you have a total tech disaster, just turn it all off, turn it on again, come and join, and come and find us in the middle. Right, without further ado, off you go, and have fun, explore. I really can't wait to hear about what you all get stuck into, and hopefully in the next 10 seconds you'll get safely into a room. Right, let's see where that gets to. Now I know Lucy's driving her car, so I'm very hopeful she doesn't put her camera on. Kate looks somewhere wonderfully exotic. Sandy, well, there she is. That's Lucy in her car. Sandy's down in Devon, if I've got that right, and watched. And Kate, hello, welcome, and you're very exotic. But then I look at your name, that makes you up in Archway, doesn't it? And oh, you're on mute, Kate. Yeah. Oh, don't worry. You're going to get off mute in a minute.
Here we go. Yeah, no, I'm unmuting myself now. Yes, I am. This is am I very echoey?
Not to us. It looks like there's two versions of you. We've got you twice, which is extra special for us.
To myself. Let me leave.
I hope only one of you leaves. There you go. We've got.
I'm here now.
The Alpine Kate has left, and we've got Archway. We've got Archway Kate here.
Archway Kate's back. Yeah. Sorry. Yeah. The Alpine was just. I put that up in the middle of winter because it was so. I felt a bit less dismal, but it's fine to just be blurred now.
Oh, well, listen, wonderful to see you, and I'm lucky enough to live just around the corner from you. So, yeah. So exactly, and Jill's here. Jill, fantastic, and Katerina as well, brilliant. Listen, and I have a feeling, Alex and James. Now, Alex might be here for his very first one of these, and promised me. And Luna's here as well. Luna, welcome. There is Alex. Look at it, and Luna's here. As well. So listen, Luna and Sandy, we've got the benefit of having you in our little mini breakout. It'd be great to hear from you about are there some other things, and you guys have been exploring this with great depth alongside Will. Are there other things that you'd push us to think about on top of that? And then it'd be great to hear from everybody. We've got a good quarter of an hour or so. Luna, do you want to sort of come in first? Listen, I want to know, how on earth did you guys kick this sort of partnership off across Exeter and away across into Duke? I mean, is there's some sort of secret tunnel across the Atlantic, or what's going on?
Yeah, basically. I think there's not that many people researching shame in medicine, so we seem to all know each other, which includes Sandy. But like serendipitously, Exeter University and Duke University have a partnership, so they've got pots of funding that you can apply for to do projects between the two universities, and we've received a couple of those pots. So there's a lot of pathways for us to collaborate through the universities. So yeah, just a coincidence, really.
Fantastic. And Sandy, I've got a question for you guys. We're thinking about Will's slides in particular. The imagery is just absolutely amazing, and what a talented artist. The piece about it's almost the last image. There was the one that sort of got me really thinking, and we've been thinking about this in the context of kindness. So there's the sort of asset-based angle and thinking and role of, but there's also, in a sense, what the first images they had a sense of deficit to me. They had a sense of, and it feels really important to explore these through both lenses. So one of the things we as a wider group have been learning is there's an awful lot of things that you can do that are very promoting and asset based and role modeling, but actually there is something also about tackling some of the issues where behaviors are very poor, and it struck me that the imagery had two sides of the coin as well. where shame was dominant, and that final slide where there was a feeling of sort of reaching out, a feeling of listening, a feeling of kindness. But it'd be great to get your take on that, and where, you know, where in the research, so presumably exploring sort of both angles of that.
Was that directed to?
Yeah, Luna, Sandy, either, come on, either of you pile in, and then we're going to hear from everyone else.
So yeah, I can speak briefly. Like, we've been in our research project, which is looking at negative self-conscious experiences like shame and others in the NHS. We've been asking people about negative self-conscious experiences. So we're getting like diary entries and critical incident reports, and then doing interviews with people, and we're getting kind of all sides of that. Yeah, we're getting the sometimes mistreatment that people experience, or the bullying, or then just shame, or those emotions that arise because of mistakes or error or imposter syndrome. And then there is part of what we're asking is like how people process and resolve those emotions. So we do also get accounts of the kindness and the peer support, or the lack of. So it's trying to see all sides of the picture. So it's not just the individual experiencing something, but it's actually an individual networked with others, but also in an institution with a particular culture and a set of practices. So we're trying to make it a as whole, well-rounded a picture as we can at the moment.
Fantastic. Sandy.
And I think Will touched on the two things really: the self-kindness, which is the really is what a lot of people find extremely challenging, and is not really promoted as a skill set of a medic, I guess. You know, it's not really. Self-compassion just often isn't really highlighted as a key trait that you need in medicine, and this idea that you need somebody else, you know, having somebody else there to talk things through with, and being met by empathy is the really key. Those are the key steps really that you need in order to be able to resolve this horrible feeling of shame. I teach a lot of doctors about shame, from all different grades of doctors, and I think their experiences are completely universal. I haven't, you know, and often people talk about incidents that happened maybe 20, sometimes 30 years ago, that have sat there kind of festering away, and they haven't had a name for it. And being able to name something as shame, being able to understand that that's what that emotion is a really powerful learning that enables them to then start processing it and being kind to themselves. And I think the word that is the phrase that we're often using at the moment is moral injury. That's a key phrase that lots of people recognize, but really the underlying emotion behind moral injury is still shame. And we seem really averse to using the word shame. So we use imposter syndrome and moral injury as our kind of comfortable substitutes, really. But I don't think they really help people to process it. Whereas when we can name it, then people can deal with it.
It takes on the emotion piece, doesn't it? Because moral injury, sort of, as ever, we're as doctors sort of trying to medicalize. The other bit that I love what Will talked about was why guilt is different. And I can, as a doctor of 25 years, I can think of some things going back a long way that actually I don't feel guilty about. So I haven't really had a language or word to name, but as I listen and think, feeling ashamed about stuff feels like. Come on, let's hear from some other people. Katerina, come on, you're a regular here with us. Be lovely to hear from you. And Jill, I mean, come on, who's going to pile in? Katerina, you're on mute. Come off that mute button. Jill, why don't you go next? And let's hear from Kate as well.
Okay. Sorry, was Jill going next?
No, you're going next.
Okay.
You're now.
Okay.
You're on the hot spot.
So well, at the risk of being first in, I'm not sure I quite get it, because in terms of like the definition of it, because I'm glad you said moral injury, because I was wondering all the way along, is that what you're meaning? It's a little bit. It's sort of kaleidoscopic, really, isn't it? Because it's, which bit of it do you mean? First of all, people start from different starting points. So if you've had a solid childhood where you have been built up and you are confident in yourself, you know that obviously you can make mistakes, but that, you know, you're trying to do your best. And, you know, and also I don't want to be banging on about Christianity, but there is a Christian side that, you know, you're made in the image of Almighty God, and he died for us so that we can leave these feelings of shame and guilt. Now, obviously, guilt is if you've done something wrong, so that's different. And if you haven't had that sort of starting point, you're much more likely to get into trouble. So, you know, so that sort of merges with teenagers on the internet getting caught up in these suicide sites where they think they're terrible. But you know, if you can catch someone while their personality is being formed and give them that healthy background, then those other feelings are never going to become out of control. So that's one point. And another quick point here. Yes, well, it was mainly about those lines, really. I couldn't really work out why you would, if you're trying to do the right thing all the time, why you would need to beat yourself up. You know, there are other things. There are burnout classes. There, you know, if you're recognizing causes of stress or other things that, you know, that you need in terms of self-kindness, etc. And I also, you know, I don't have any problem being kind to myself, you know. I know when I can do a spurt of work, and I know when I need a break, and it usually revolves around retail therapy. But, you know, whatever your thing is, I have no problem in just going to an art gallery or just being creative or whatever. And there are so many things wrong. And so to pick up the bullying thing, I mean, if you're at the end of the bullying thing, there's nothing for you to be shameful about. It's the person perpetrating it that needs to be shamed. And also, I've long since stopped worrying about the fact that I might not look as if I've achieved, you know, very much, because I know I've done my best and I'm very good at what I do. So I don't, you know, worry about it anymore.
So really interesting, some super interesting perspectives, and I'm interested in your any more bit. So we'll maybe let's hear from Jill, then let's go to Kate, and then let's hear from Alex as well.
Okay, so hi everyone. I think I'm in this extra group because I'm in Verona, and I think perhaps the connection's a bit different.
You just had to slip that in, Jill, you know.
But I absolutely love these conversations. It shows how people just join, you know, it's like a real priority. Gorgeous. So, I mean, I guess, I don't know if this is how you feel about this, but I guess how this resonated with me are really powerful images. I tend to look at things often from the patient point of view, and I could think of so many different examples where you could flip it. And the three that came to mind for me, and very often, as in most of what I do really around, I'm the creator of a tool called Whose Shoes that looks at things from different perspectives. So the patient perspective, and say in maternity, I put something about this in the chat, the language that can be used can be really, really traumatizing. So if a mother is told that she's failed to dilate and she's failed to progress in labour, and possibly her friend's got an incompetent cervix, and there's a lot of language I think that people use. And then I thought of the work that I do around children and families, and the big theme that's come through is around, and I think it's either guilt or shaming or a bit of each, of parents whose children are different and who I don't know, I've just been amazed. I'm working with somebody called Yvonne Newbold, and it's absolutely the number one theme of parents, to be feeling that they're constantly having to defend their child as part of trying to get the right healthcare, care really, and treatment and so on. And then the other one I thought of, which I think I've got right and would be an absolute gem, is different example, but if in mental health you're told you've got a disordered personality, I don't think I'd like that too much. So that was just my kind of reactions around guilt and shame and healthcare.
Gorgeous.
I love the incompetent cervix. There's a cartoon there already.
Jill, do you put your lovely Whose Shoes link in? Because if Luna and Sandy, they may know all about you, but if they don't, Jill's a wonderful person for you guys to connect with, and I suspect you'll have some fun together. Right, well, time is not with us, so let's hear from Kate. I want to say hello to Alex. Let's pop to Lucy. Kate.
Hi. Yes, I want to say how pleased I am to be here. This is my first meeting, so thank you very much for inviting me, Bob. I'm a recently retired GP, and I'm a coach in the NHS. So I coach a lot of people, and I come across a lot of people who carry shame for whatever reason. And I'm very interested. I'm very interested to hear what everybody said, but I also think it's quite interesting to think about the people who cause shame. So the people who, in those wonderful pictures, the people who do the humiliating, the people who make people feel ashamed and that they're not worthy somehow, because I think that something's been done to them too, hasn't it? It's been a kind of continuum of and I think that I sometimes end up coaching people who do that, and you can see that it's often people who have burnout, it's people who are very stressed, it's people who are overworked, and nobody, I mean, virtually nobody wants to start off being unkind. Nobody wants to be an unkind person. So I think that's all I'll say about it really, but I think that's quite an interesting thing to think about.
Yeah, super, Kate. I love how you were drawn to those people, and we were talking today about, I mean, self-esteem feels, I'm fascinated by where there's poor behavior, about how time and again I sort of need Freud to come and join these calls and talk about ego. And anyway, listen, Alex, come and say hello. You had your hand up earlier. You brilliant. We met recently on email on a great intro. Come and say a quick hello. Yes. Then let's pop to Lucy.
Thank you, Bob. And I'm coming from North Carolina, the other across town. I'm not at Duke, I'm at UNC, but you know, it was fascinating talk, and I picked up a lot from everyone's comments as well. The discussion after the talk even was as insightful as the talk itself. So I appreciate you guys inviting me to this forum. But the thing that struck me, as well as some of the things that you all had already mentioned, was I think it's also about expectations as a provider or a student or whatever, that you are going to have these sort of ups and downs emotionally, and you're going to have you know, you may not live in shame, you know, your entire experience, but you may have moments of where you feel down or you feel ashamed of you know, what, you know, kind of what your role in a situation may have been, even different from guilt, but just sort of feeling a little bit less than in certain instances, depending on your circumstances. And I think just that recognition that, you know, to stick with the program, to function forward, and, you know, you'll pull out of it just like you pull out of most sort of emotional cycles.
Alex, thanks so much. So loads to think about and unpack there. Time's against us. Let's hear from Lucy for Luna and Sandy and other. Lucy, I'm going to. Lucy's a wonderful friend who's been coming along to these calls. Lucy, you can take the conversation where you want, but one angle that makes me smile is the doctor manager bit. So Lucy is a brilliant and very you know, thoughtful and proud manager, and proud of that role. But there's a super interesting bit about, I think, how some the tribes bit that we have in healthcare, and you know, I have the privilege of wearing a doctor badge, which sort of, you know, leads to all sorts of things, you know, good and possibly problematic. And Lucy, you have a, you know, the sort of dark side of management moniker sitting above your tribe. But come and say hello. You know, I feel very differently about it, but
yeah. That's not what I'm going to pick up on this time, because I had some other.
Go where you want to go, and we've got about 2 minutes, and everyone's coming back.
Okay.
So
well, the first is a quick one about imposter syndrome, which interests me a lot, and just a thought that, you know, even that we're medicalizing, or, you know, rooting in the person who you know, making it a syndrome that the person who feels it suffers from. And there's a strong argument to say that actually, if at work you feel like an imposter, it might well be because actually you are discriminated against in lesser or greater ways. And then what was the other thing I want to say? Yeah, I got really interesting situation with a colleague who's just come back from long-term sick leave, who is feeling very, neither of us would use the word shame, but actually it's the by the definition that we looked at, is that kind of thing where feeling really as if she's not good enough anymore by comparing herself to others. And I've been really trying to sit with, how do I be kind, wanting to be the kindest I can be in that situation, but struggling between, just listening, and validating that feeling, or actually wanting very strongly to say, but that's not right, you're not, you're much better than that, and actually, here's the value that you're adding, but actually that maybe that's negating her experience. So those are just a couple of things that the discussions brought up for me.
Lovely conundrums to be weighing. Listen, as ever, time's never on our side. Everyone's coming back now, so let's we're going to enrich and others. Lovely, Julie, lovely to have you with us. Right, welcome back.
To see you all.
It's great. Jill's tech is too fragile. Jill in Verona. I hope you've got a great musical tour. I'm worried that my trust intranet will get in the way. Right, we need some mute buttons on, guys. Let's see whether whose shoes, typical. My organizational intranet is blocking it, but I think this is going to work. Nutshellcoms.co.uk, Jill, is that right? Is that the way in?
Yeah, just Google whose shoes, probably, Bob. Thanks ever so much. That's nice of you. Kind, very
perfect. Kind. Right, listen, welcome back. I'm hoping we've got Will. I was lucky enough to end up in a group with Sandy and Luna. It was wonderful to hear from you guys. Loads of conversations, but look, as ever, let's hear from people in the chat, and it'd be great to hear some voices and thoughts. So please stick a hand up or two if there's things that you'd like to share. And in fact, Luna, Sandy, I might get you just to comment a little bit on. I was finding out. Luna, come and say hello, because it will be and Sandy. Come and share with the group a little bit about what we were talking about in our little main room, and I guess any reflections you had on that.
Yeah, I can say hello. It's really lovely to be here, and thank you so much for having us and hosting this conversation. And I think what I was really struck by our group was the diversity of experiences that people discussed and talked about. So it really makes you realize that we're all just having very different experiences and processing things in different ways. And it was really cool and interesting to hear about different, like what the talk brought up for different people, because it was very different. Everyone was kind of looking at it from different perspectives. So it was very interesting.
Agreed. And if we'd had it, I suspect if we'd had more time, we'd have found even more. But I totally agree, wasn't it? It was amazing in 10-15 minutes on that. Sorry, you saying an and. Come on.
Oh no, and then I was also we had a little chat in the chat. People were bringing up kind of examples of the language, the way like shame and judgment and negativity can be embedded in the really ordinary language that's used to talk about medical conditions or behaviors in medicine, like heart failure, or what was the one about the
failed uterus.
Cervical incompetence.
Incompetent cervix.
Yeah.
Entrenching the shame in the body.
There's a fascinating angle, as I'm a pediatrician for Luna and Sandy's benefit, and one observation I've made, which is almost a flip the other way, is in conversations with mums about breastfeeding, is the word natural. And the word natural means lots of wonderful things of, biological and all that, but also it means easy to some people, the naturally gifted tennis player or whatever. And my experience of being a pediatrician and watching, breastfeeding is the most wonderfully great, but it's extraordinarily hard. It's hard work. It's it's something that people work incredibly hard on. And it's been a fascinating bit watching mums finding it very difficult to breastfeed, but very determined to do it and doing incredible things, feeling a great sense of shame because It's meant to be natural, i.e. easy. That's always a word that I've got into some lovely, interesting, so almost a flip around. Sandy, come and say a quick hello. Then I'd love a hand or two up from anyone else. Maureen's got a hand up. So Sandy and then to Maureen.
Yeah, hi. Lovely to meet you all. And like Luna, it's great to be invited along. So thank you for all sharing our interest in shame. It is, I hope, and I guess my kind of aspiration is that it's one of those things that once you start noticing it, you actually start to see it in all sorts of corners of medicine, both from the patient's perspective, but also very much from the doctor's perspective. My particular interest is around those younger doctors who are forming what we term the professional medical identity, which is this sort of set of values and experiences that are embedded and experienced, I think, by doctors all the way around the globe, that they would share. And shame forms a huge part of that identity formation. And we touched in our group about people who are maybe later in their careers, maybe not feeling that shame so much now. But it's certainly an experience and an emotion that I think is experienced more by younger colleagues who are at that stage where they are naturally more vulnerable to experiences of shame. So that's just something else to sort of throw into the bucket. But it's lovely to have you all interested in this topic and how it links to kindness.
Thanks, Sandy. And we've done a lot of exploring on this group and with about psychological safety, and I wonder whether the importance of creating psychologically safe space, particularly with younger, earlier career colleagues who are perhaps at greater risk of feeling a sense of shame, that's part of the reason it's so important. The wonderful Amy Edmondson is a friend of this group and has been a relative regular. Maureen, always wonderful to hear from you. Come on, where's this taking? I'm sort of can't second guess this one. Where's this taking you?
Oh, we had a fabulous conversation. I had Suzie, Nicola, and and Dina, and we lost Rich for some reason, but
he came to see me. Rich came to see me.
A fabulous conversation. One is we all confessed what the word meant to us and the emotional response we had to that word shame to begin with. But then we started talking, and we had great both ideas about how we might teach young people, how we might deal with kindness as an antidote to shame in the workplace. And a lot of the conversation ended up to be about how do we take care of ourselves when we're feeling shame. I was saying how I always say you can't give what you don't have. And so we've got to take care of ourselves. And it just came up. But the biggest part of the conversation that was really filled me with joy was everybody who spoke went back to one of the pictures and said, well, remember when the light was coming through the doors, or remember when the person was holding up the white coat. And it really was so powerful to look at those, and everybody in our group resonated with some or all of those words, and then the sense of hope and optimism that we could deal with this.
Yeah, Maureen, what amazing. I feel like I was in your group. That was so such a beautiful description. Fantastic. Bimby, hello, my friend. And listen, look, I got something in the post here. This was, thank you very much. So a public thank you here as the post-it that came through. But Bimby, come and say a quick hello. We're nearly out of time, but come and say a good hello.
Okay, thank you. Well, look, we were in a great room. We had Will there, so it was wonderful to have him there and to chip away and ask him a few more questions. We had Jane, who works in HIV medicine, and was really talking about the everyday shame and stigma that is there and present. But she also reflects a little bit more deeply about the transference of shame to other areas. So if a patient with HIV goes to another department or another area, the shame that may be transferred for the patient, and so that was an interesting insight. Hope I did that justice, Jane. Vibeke from Copenhagen, who is a physician but not currently practicing, I think I got that right, just talking in particular about the second victim in healthcare and adverse events, and how she would like to see a proactive culture, so that this is a little bit around the psychological safety that we've talked about earlier. And Sebastian, a pediatrician from Great Ormond Street, hadn't really thought deeply about shame recently and hadn't experienced it for a while, but reflected on this and obviously felt that shame is pointless, and that led to an interesting discussion about, is it pointless if it evokes such an emotional response? And so we agreed that we wanted to reframe it in a positive light. And so, a suggestion was that kindness is the light to the darkness of shame, was sort of put across as a way to try and sort of use kindness in that way. I shared some of my experience as a training surgeon and the shame I was exposed to during an M&M, and this led to a wider discussion around the challenges of this. And surgeons, there's often a pride of having grit in your training, having your passion and perseverance in the face of hardship, and how it's character building, almost that you have to feel an element of shame at some point, or carry certain things with you. And we'll ask the challenging question: have I ever witnessed a kind morbidity and mortality meeting? I had to reflect on that and honestly say, no, I haven't. And so we talked about how we could make it kind. And the sorts of suggestions were having someone who has the gravitas of seniority, who can probably share their experiences, provide that psychological safety net right at the very beginning, and share their own experiences and think about the second victim. So that captured some of the discussions from our room. So hope I covered that all.
We have such talented summarizers on this call. Absolutely amazing. Right, listen, we try and finish up your time. Martin, you come and say a quick hello. You've got about 20 seconds. That's all. I'm going to be super tough, but come and say hello.
Okay, 20 seconds. I suppose in slight response to something Bimby said early on, which came up in our conversations about what's the point of shame and should we have it, I suppose one of the things we talked about was, if you haven't got shame, then are you shameless? And nobody wants to be shameless. And so we have to sort of embrace shame, because otherwise we're shameless, and that doesn't seem a good way to go. So there we go. I hope that was less than 20 seconds.
That was absolutely legendarily done. It was less than 20 seconds, and it was an hour's worth of power. Martin, amazing. Thank you. Will, final reflection and thought from you, and then I'll literally wrap up in 30 seconds.
I mean, just what a great feeling this is. There's not much to say, only just what a wonderful feeling it is to be in a group like this. We're talking about something that's really hard, and yet I feel more connected to a group of people I didn't know an hour ago, and I've smiled a lot. And so I think what you're doing here is special, and this is the way we work with these experiences, openly, honestly, in a humanistic way, and with the ability to smile. So thanks so much for having us, and what an awesome group. Can't wait to be back.
Yeah, thanks so much. Well, listen, I think my big takeaway is your last amazing image. I think everyone wants Hannah's number, because I've got a whole load of things that, but that last image, and I think this exploration, there is clearly a super interesting relationship between the work that you're doing and the work that lots of people on this call, and indeed in the wider community. So we could definitely keep in touch. I've got a job to do to make sure that you and Luna and your Sandy and your wider team have got the invites on an ongoing basis. Come and join whenever you can. For everyone else on this call, do scroll back up in the chat and find that link and that QR code and the Google form. I'll be filling it in myself. So that we can keep in great touch. And it feels like some really interesting, there's a strong research underpinning as well to a lot of people on the call. So Will, for you and Luna and others, I know people looking to collaborations and things. There's some super people who I'm sure would explore that. Right, we've hit time. I'm going to see some of you in Utrecht next week, which I'm very excited about. I'm going to miss all of you who aren't there. We've got Maureen. In fact, come and do 10 seconds. We've got a friend, Diana, is coming to talk next time round. Come and tell us a moment about Diana.
Yeah, Diana Chapman Walsh is a former president of Wellesley College here in Massachusetts, one of the big women's colleges, and a former board member of the IHI Board of Trustees. And she's doing a lot of work on mindfulness and reflection, and how do we think about taking care of ourselves and using kindness as a way to care for others. I think it's going to be a fascinating conversation. So I'm looking forward to seeing you all there next month.
Amazing. And then we've got the wonderful Heidi Larson, who's on this call, who's going to be with us, leading us in July. And we've got some gaps ahead in the autumn. So if you're feeling inspired and you want to come and just, host a session for us, then please do. Thanks, everybody. Unbelievably wonderful to see you all, and a particular thanks, Will, for leading us on that, and to your wonderful friends and colleagues. Loads to think about and feel warm about. I've been smiling too. Catch you all soon, and take care. Have lovely evenings, mornings, and the rest. Take care. Bye, everyone.